Hi, Dr. Lou here from Beach Cities Laser Vision. I'm going to be going over what a cataract is, what tests are done before cataract surgery, what you can expect from cataract surgery, what the limitations are, what the risks and benefits, of course, and what to expect during the healing period. So briefly, how does the eye work? Here's your eye. Light goes in through your pupil, through your cornea, and then you've got a lens inside of your eye here, and all of this focuses the vision back here to the retina. And as we get older, this lens actually gets stiffer, which is why we start needing reading glasses or bifocals, and eventually it actually turns cloudy like this, and that causes light scatter glare. During about a 15-minute procedure, we take this lens out, and then we put in a new lens here, and that allows you to see clearly again. So as you can see, we're not really touching anything in the back of the eye. We're not touching the retina, the nerve, or anything. So if there are problems with like glaucoma, macular degeneration, macular pucker, this procedure doesn't fix that. But a lot of patients, their main problem is the cataract, so we can fix that. When we do fix that, it typically does improve the vision, and also you have the option of getting something called a multifocal, which has lots of rings and allows you to see distance and up close. I have probably previously already discussed with you what the pros and cons of getting multifocal are, and we've made a decision based on what your hobbies are, your expectations, the rest of the eye anatomy, which one to go with. The advantages of multifocal is that you can see far and near. The disadvantages is because of the rings, and if you have other problems in the other parts of your eye, whether it's dry eye, again, macular degeneration, glaucoma, if your eye is already compromised, then we don't want to compromise it further by having rings in the lens. But if you have an otherwise healthy eye, then most of the time the brain can adjust to that. We can sometimes do both eyes one after the other the same day. Advantages of that is that you can heal from both of them at the same time, but disadvantages are if you do have other problems with your eyes, or that is a slightly high risk procedure based on your particular eye anatomy, then we don't want to compromise both eyes at the same time. But for the vast majority of patients who have healthy eyes, because cataract surgery is so predictable, usually it's good cost savings in terms of time and financially to do both eyes at the same time. But we'll discuss with you in particular which is best for you. Procedure itself is usually 10 to 15 minutes, no pain. It's really a great procedure, no pain during the procedure. We'll give you some relaxing medication, and you'll just lots of bright lights, and actually for some people it's quite enjoyable. You will feel changes in pressure, some water, but you shouldn't feel anything sharp or pokey or painful, and you'll hear probably some strange noises in the background, but for the most part the relaxing medication works quite well. So it's not uncommon that people, when we finish, they're like, oh, we're done already? And wow, that was fast. Still try to keep your eyes nice and relaxed. Right after the procedure, of course, your pupils will be dilated and there'll be some inflammation, and that's part of the normal healing process. The first day is cloudy and like underwater, so we do want you to go home and just rest that day. And you'll be taking some eye drops, some antibiotics plus steroids plus NSAID, and all of that should be in one eye drop. You want to use that drop one day starting before your procedure for 4 times a day, and then you just keep using that eye drop for 3 weeks. And usually that's enough. Sometimes if more additional eye drops are needed, we'll take care of that as needed. And then the next day I'll see you and just check your pressure, check your vision, make sure everything looks good, and see you again in 1 week. During that 1 week period, most people can do regular activities. We do want you to wear an eye shield at night over whichever eyes were operated on, so that if there is some minor irritation, which is not uncommon, like you have something in the eye, then you don't accidentally reach up during the night or while you're sleeping to rub that eye. During the day, just sunglasses when you're outside should be fine, and if you're indoors, then it should be fine not wearing any sort of protective glasses. And then during that first week, do take it easy, so no heavy lifting, no bending over, no water, dust, dirt into the eye, but you can shower after the first day, so 24 hours after the procedure. Just make sure that you keep your eyes closed, and if you let water run over your eyes, that's fine. And we do want you to occasionally let water run over your eyes, because we don't want all the drops or just some tearing and everything to crust up and cause discomfort that way. But we don't want water getting into the eye. So keep the eyes closed, let the water run over, and do a gentle pat dry before you open your eye so that water doesn't drip in your eye after a shower. And then A lot of people can drive, but come to your first post-op, make sure everything looks good and you feel comfortable before you drive. Also, there might be some irritation, maybe a little shimmering, strange light phenomena. Those should improve with time. But if you do see lots of bright flashing lights, even with your eyes closed, or shadows in your vision, or of course any sudden drop in vision, we don't expect any of those things to happen, or pain. The recovery from cataract surgery should be quite easy. And we'll be seeing you at 1 day and 1 week as well. But if there's anything strange in between, make sure you call us, email, text, any questions at all, or if you lose your eye drops, let us know so that we can help take care of that. Usually after a week, the vision's pretty stable, and if you do get the multifocal, that can take some time, or if we do what we call blended vision or monovision, which we do for a lot of patients who don't want the multifocal, where one eye is set for distance, one eye is up close, it takes time for the brain to adjust to those things. So for both of them, if you need some temporary glasses or eye drops to help with any glare, which is expected after the procedure, that's something that we can certainly help with, and something that is not unexpected during the healing process. And even after the healing process, which may take several months and even up to a year for some people, you might need glasses for your best corrected vision. And if there is a residual prescription, even after we've done all of the measurements, which it happens maybe in about 5 to 10% of patients, we can either, you can use contacts, you can use glasses, or we could consider doing a laser procedure. Or if it's a very dramatic difference or you can't get used to the lens that's in your eye, we can do a lens exchange. So we prefer not to do that, obviously, but that is something that's available for people who are still really bothered and want to proceed with that. And then that's included in your procedure fee if you go through Beach City's laser vision. Usually if you go through insurance, then that is another additional fee, and that's why we like our model where we can just take care of everything for you, and it's much more simple to think about. In terms of risks of the procedure, so for the most part, this is an awesome procedure, and the benefits is that you can see much better and really reduce your dependence on glasses. And for a lot of patients to not really have to wear glasses at all. Of course, there's no guarantee of that, but that is the goal. And for most patients, we do reach that goal. And also the lights will be brighter. And if you get your cataract surgery done before you have significant cataracts, which are needed for insurance to cover, we prevent further cataract development. So you don't have to go through that part where you do suffer and you can't see well. Limitations of the procedure. So again, no guarantees, and we are not fixing the rest of the eye. You still need to get regular eye exams because other parts of the eye are still important for your vision. And then for risks, so the main risk is that we do all these measurements and we get some residual prescription that's significant. Either we take care of that with surgery or we take care of that with glasses or contacts. We try our best to minimize that, but it's something that can be fixed with other tools. Maybe in about 20% of patients, we put the new lens in and it gets a little bit cloudy and it needs a laser cleanup in a few months or a few years. That's something that can be done in the office and is quite safe. So those are the two most common things. And also if you do have the multifocal with the rings or the blended vision, that takes time for the brain to adjust. So those are all parts of the normal healing process. In terms of risks where there's potentially damage to other parts of the eye, so I'm just going to list a bunch of things that are listed in more detail in your consent, but most likely not going to happen to you. Damage to other parts of the eye, swelling of the cornea, high eye pressure, retinal tears, detachment, bleeding, infection, significant inflammation, unable to put the lens that we plan to put in, or unable to remove all of the cataract safely. So all of these things altogether, less than 1% chance, needing another urgent surgery by another surgeon or myself. And then of course we do have to say loss of vision, loss of eye anytime we have any sort of procedure. Again, that's extraordinarily rare, but we have to mention them. It's surgery, so we have to say that is a small possibility. Otherwise, for the vast majority of people, millions of these procedures are performed every year, and for most people, they're very happy and they do very well, and it is truly a privilege to be able to do a procedure that has such immediate benefit for my patients, and to see how much of a difference it makes in your life and in terms of how well you function and just enjoy life. So looking forward to that. Anything else specific, of course, we're available for you to ask, either respond to any emails that we sent you, text, or just call our office.